Am I audible, sir? So, shall we begin the class, sir? Do you want to check out the slides before we start?
Okay, once I will see.
Okay.
So you see whether it is coming, you see. Okay.
Sure, sir.
Oh, PowerPoint. Can you see it? Can you see it? Can you see
Yes, sir.
whether it is moving, changing,
Yes, sir.
changing? Okay.
Yes. So, good evening, everyone. Welcome to another fantastic session here with Team CAME. Today, we'll learn about the topic Shirashula, the concepts and practices. And to educate us on this topic, we have with us Dr. VKV Balakrishnan, sir, who has a soaring practice in Shalakya Tantra as well as general cases. Dr. VKV Balakrishnan, sir, completed his BAMS from VPSP Ayurveda College, Kottakkal, with first rank university record and gold medal. And he went on to complete MS in Shalakya Tantra from Government Ayurveda College, Bangalore, and secured the first rank in Kerala Government Medical Officer exam in the year 2004. Dr. Balakrishnan, sir, is now the Associate Professor at Department of Shalakya Tantra at Government Ayurveda College, Kannur, and is actively involved in educating the bright young students in the Ayurveda field. His outstanding knowledge in modern as well as Ayurveda is what makes him so special. And one other special thing I would like to add about sir is that he can recite Ashtanga Hridaya shlokas from the first chapter to the last chapter by heart. And that is very impressive. So please, I invite you to take over the screen and begin this session. Welcome to Team CAME, sir.
Good evening, madam. Introducing me. So my given topic is headache, concept and practices. So what I want to tell is, so everybody know the theory. I want to give small introduction related to the theory topic, and I prefer is a discussion, not only a one-sided one. I kindly ask questions to me, so that will be more appreciable. I like to share my knowledge to people like you. Being I'm interested in practicing in Ayurveda since more than 30 years. I'm practicing, and I'm managing almost all the type of cases related to Shalakya Tantra. So especially the headache, which comes in the OPD, different types. So apart from the knowledge, I will tell you what is headache. It's itself a headache. Whether it can be treated by a person or physician, or it can be by a ophthalmologist, or it can be treated by an ENT specialist, or an endocrinologist, or can you hear, madam? Or an endocrinologist, or even a psychiatrist. Actually, the problem begins in the head. So that is introduction related to headache. It is not confined to a particular person. It needs a team of doctors to manage a headache. It may be a simple tension type headache to a major encephalitis or intracranial pressure headache. So diagnosis is very crucial. Based on the diagnosis, the management goes. So it is not a simple thing to diagnose a case. A detailed history may be needed. Maybe relevant examination is needed, including the even today it is MRI. Then various other blood investigation like that. I'm not going through all the things. I will still in words. Okay. So as per our classic, headache is mentioned in Shiroroga Vitnanian chapter in Uttaratantra. So we see that Shiroroga Shabdena, Shiroga the Shularubaruja Abhidiyade. It's the pain which is felt inside the ear, inside the head or in and around the head. So classified variously. According to Sushruta, it is 11, and Vagbhata, it is 90 as theoretical part, and Charaka, it is 5. And Sushruta explained Anandavada an individual criteria and Chayajasirasula an individual criteria, where Bhagavata divided into 10 and 9 including the scalp disorder and the remaining 10 in the headache disorders. Okay. So that's the time, the details of the name. We know about all the things. Okay. Means some day-to-day life, we very commonly what we are seeing is our Ardhava Vedaka and Suryavarta and ordinary Shirasula. Okay. So I'll go to the etiology, what our Acharya told. It's a relevant question. As the treatment always with respect to the etiology. So assessment of the etiology, knowing the etiology or assessing the etiology is very essential in the management of headache. So Acharya told Dhuma, Atapa, Tushara, Ambu, Krida, Adisopna Jagare, like that. So what is Dhuma? How Dhuma relates in headache? Dhuma is an area where smoke is present. So automatically there will be reduced oxygen. Partial pressure of oxygen will be very less. So the person inhaling a reduced oxygen, a hypoxic condition he will feel. That hypoxia results in type of headache. So management will be like that. Give saturated amount of oxygen to him or make him to respire in a free air or in open air. Our treatment starts with Upavasa Anila Adavachaya, like that it is. Actually, Adravya Chikitsa, Adravyam Puna Upavasa Anila Adavachaya. So here itself the treatment starts. In a person who is exposed to Dhuma or an area where he's reduced oxygen, he has to be treated with according to that Adravyam Puna Upavasa Anila Adavachaya, like that. That is needed besides our medication. So Atapa, exposure of sunlight, results in dryness of the nose or hyperactivity of the mucociliary system. Tushar is a low temperature area where increased warmth is needed for inspired air will be to be converted into the hot air. So for that, the mucociliary system in the nose has to work so much. Or moreover, our exterior opening of scrotuses will be closed due to the tushar or the low temperature. Ambukrida increases forceful entry of water in our sinuses through the nasal cavity or even ear or in our throat. Such like it results in headache. Atiswapna. Atiswapna means excessive sleeping, delayed sleeping or delayed sleeping. So sleep character of sleep. A healthy person should sleep 6 to 8 hours in a night. So our present day scenario, the person who is working in the IT field may be lacking their sleep in proper time. They may work for the night, very late hours, resulting in for them a tension type headache. So such a condition should be adjusted in our lifestyle, or lifestyle modification is essential to control such type of headache. Ratro Jagaranam means due to the work or other stressful factor, a person won't not able to sleep in the right time at the night. Alcoholism, Madhyapana, Atyambu Madhyapanena, Krumidhi, Vegatharanahi, Atyambu Madhyapanena, consumption of alcohol, okay, and not in the proper manner. So results in changes in our circulatory system, or modification or reduction in the level of glucose in the blood, resulting in headache. A type of Shayajasirasula comes. Okay. Over drinking of water, presence or absence of cremies. So actually, when there is a worm infestation, our body results in nutrition, vitamin A deficiency or vitamin deficiency or nutrition deficiency. So such a nutrition deficiency may result in type of Shayajasirasula. We call it a Shayajasirasula. Vegadharana. Vegadharana, yoga sarvebi jayande vegodhirana dharanehi. When I heard that, yoga sarvebi jayande vega udirana dharanehi. So the natural urges which has to be eliminated, it will be allowed to pass at the proper time. If we are not passing in the proper time, then toxicity in the body, if there are not natural waste, the waste, when there is increasing the waste in our body, results in internal toxicity, resulting in headache. So when we are pradishya, when there is Hagrid Vegarodha, we can Sagradaga, Pindigodeshta Pradishyaya Shiroruja. When there is obstruction of Shakrita Vega, Shakritaha, Shakrita occurring at Pindigodeshta, Pradishyaya, Shirorija. When there is Pinasa, when there is Ashru Vegarodha, Pinasachi, Shirorum. So wherever when there is Vegarodha is Vegarodha is resulted, which resulting in headache. So that Vegadharana increasing the toxicity in the body, or the eliminating waste is not completed, not done properly, it results in headache. Irregular sleeping habits. So, in which means either using or not of the head pillows, or not in a proper position. Some people may sleep in the settee itself after watching the TV, not keeping our body in proper way. Such type of conditions may result in irregular sleeping habit or resulting in headache. Actually, brain itself is a pain insensitive area. So then where the brain comes, okay. Pain is caused by disturbance of pain sensitive structures of the brain. Pain sensitive structures of the brain. There are some area where they are highly sensitive to pain. So that is the cause for headache. Actually, headache is not from the head itself. It may be from various other structures. Pain sensitive structures are mentioned as cranium, means the cranial vault, the muscles which is attached to the cranial vault, nerves, arteries, veins, subcutaneous tissue, ear, eye, nose, sinuses, etc. So when Charaka explains Ardhavabhedaga, he specifically mentioned the area where the headache occurs. Shankha, Akshi, Bru, Lelada. Specifically, he explained various area where the pain comes. So even today in the modern anatomy, there is pain sensitive areas, or 9 areas in the head and neck, specifically told that it is the cranial vault, muscles attached to the spinalis muscles or frontalis muscles, like that. Then peripheral nerves, then arteries, veins, subcutaneous tissue, ear and nose, eye, and sinuses. So what is the definition of headache? So we very frequently we call, oh, I have got a headache, I'm not going to work for today. What is headache actually? Whether it is an ache or any other thing. Headache or cephalalgia is pain or discomfort anywhere in the head, region of the head, not necessarily the pain. It may be even a simple discomfort. A headache or cephalalgia is pain or a discomfort anywhere in the head, not necessarily the pain in the region of head and neck. It can be a symptom of a number of different conditions of the head and neck. So we can't tell kerning with a herd poliomyelitis, the kerning sign. Okay, like even a headache may come in a viral fever, starting a viral fever. Even our COVID headache may be there. Okay, but there is a dehydration after post-surgical condition, after the common cesarean section. So when there is draining of CSF in the body, headache may come. Okay, after post-surgical headache, it may happen. If there is loose stools, it may. If there is a constipation, if there is acidity, or if there is any other problem, headache may present. Or even if there is lack of sleep, if there is tension, okay, it can result in headache. So after good sleep, it will usually come down. Headache, the types. We can classify many types, but when clinically it comes only 2 types, I feel. When it comes clinically, only 2 types, which include a primary and a secondary. What is primary and what is secondary? Clinical practice, we can see many types of headache, but we can include all the headache in the 2. The primary headaches, where the examiner fails to establish a specific cause for headache, either by X-ray, either by history, or by investigative procedures. We can use many investigative procedures to diagnose a headache. Where secondary headaches are due to specific causes. So we'll see what is the common diagnostic criteria for headache. So we can take an X-ray. Usually a radiography, plain radiography of paranasal sinus of Waters view. I not made an slide, I will tell now. So when there is a person comes with a headache in the OPD, when touching the specific area of forehead, nose, then the chin, and etc. If they're touching and telling that specific pains are feeling all this area, so better to have an X-ray, plain radiograph of what is your paranasal sinuses. Very mere cheap, and it is very cheap. So we can make out whether the person is having any nasal obstruction or a frontal sinuses or a maxillary sinusitis. So if it is present, the shadow or fluid level is there in the sinuses, which means that it is a primary sinusitis. We call it as a secondary headache. So where in certain condition, where the person, even though we are going on asking, they won't tell any cause. So, but usually they will tell, no, after traveling, I got severe headache. That was since 3 days I am having headache. I took painkillers. Even it is not coming down. Sometimes the person will tell, I feel nausea, vomiting, sleepy, drowsiness, like that. The headache is so severe, it is not coming down. In such a condition, we call it as primary headache, where a specific cause will be not there. And again, when we are taking even an MRI, it suggests the brain will be normal. When X-ray, it will be normal. Even hematological examination will be normal. Protein value will be normal. Everything will be normal. When thyroid assessment also we can do, that also will be normal in such kind. But rarely, thyroid may be there. Not there is no association between hypothyroidism and headache. But anemia, there is headache will be there. So secondary headaches are, so primary headache, we call it examples, we call it vascular headache or migraine, etc. We call it as. It's a very common condition in the OPD. Daily we can get many cases of type of vascular headaches. Okay. Then the secondary headache. What is primary headaches? Primary headache, such tension type headache and migraine. So tension type headache and migraine. Migraine is a commonest thing, having a specific symptoms, and it varies at specific time. And even though with the medicine it won't subside, the person feel exhausted after the attack, feel tired, clammy, and they may go for a sleep after the attack. So usually a pulsating affecting one side of the head associated with nausea, disabling in severity. Last 3 hours to 3 days, 4 to 48 hours it may last. Other primary headache disorders are trigeminal neuralgia, cluster headache, like that. I've given just an example. What is primary headache? I think you can follow it. Primary headache, prathamika shirashula. In Ayurveda, we classified in various types, but I think clinically this is the best one we can choose. Where the management will be, we can classify the management. How can we approach the patient? How can we manage the case? How can we assess the case? Even after follow-up, how can we assess? Without the expense will be very less for taking an X-ray or a blood investigation. It will be very less. Only for differential diagnosis, we can have an X-ray in the case of migraine. And with a dental disorder, then we can assess them by using a X-ray. So due to the COVID pandemic, examinations of oral cavity will be very difficult. By taking an X-ray, it will be all right. Even trigeminal neuralgia we can make out like that. Then cluster headaches. So there is secondary headache. Secondary headache means with respect to others. So headaches may be caused by problems elsewhere in the head or neck. So if headache associated with a sinus cavity, eyeball, eye, nose, ear, oral cavity, neck. If there is any cervical spondylitis, the headache, cephalalgia may happen. We call it a cervicogenic headache. Maybe minimal, but even though the person may, sometimes they may complain of severe headache. Even they can't tilt the head, they can't turn back the head, they can't move the head, and even occipital sinusitis. Okay. Or overuse of medication. Those who are simply using medicines for headache, now and then they use painkillers. That results always in nociceptive blockage. That results in severe headache after if they are using very frequently. Such a type of headache we can call it as secondary headache, where we can see either a sinusitis or a nasal block or an angle closure glaucoma or an open angle glaucoma, or even tonsillitis or pharyngitis or cervical spondylitis. Such things we can see in secondary headaches, where the specific cause we can elicit by history or from investigation, biochemical investigation. Whereas examining the blood serum or even taking an X-ray or MRI or anything, we can assess secondary headache or primary and secondary. These are the clinical types of headaches which we can use in our day-to-day practice. For medication, it will be different in both. This is another one, subarachnoid hemorrhage, usually a ruptured of brain aneurysm with fever, meningitis, and with confusion. We call it encephalitis. Japanese encephalitis. You may have heard where the person feels confused state. Okay, searching something in the sky may be a warning sign of death usually. So, encephalitis, you may have heard the Nipah virus usually results in encephalitis, which is very similar. It is actually Japanese encephalitis. So, such a headache, even that is included in secondary one, but it results in very aggressive manner. The person won't survive after the attack. Okay, that also comes in secondary headaches. Then headache with increased intracranial pressure, usually associated with vomiting, or a type of vomiting as a projectile vomiting due to intracranial tumors or something. Raised intracranial pressure can be seen in brain tumors, idiopathic intracranial hypertension, cerebrovenous venous thrombosis, like that. So such a headache we have to be differentiated as it is an emergency. Retrobulbar neuritis, okay, example retrobulbar neuritis, angle closure glaucoma, etc. are a rare clinical emergencies, common clinical emergencies which with the headache. Even though it is headache, so trying to manage the headache without knowing the proper reason will be a dangerous to the person. Okay, so increased intracranial pressure can be made up by the type C in the vomiting, projectile vomiting. It will be then pupillary reaction will be different. Then raised temperature. Okay, sometimes raised temperature, exhaustion, variation in the blood pressure, and by we can see assess the CSF or lumbar by lumbar puncturing or examination method. We can use our MRI scanning or any other thing. By analyzing the reports, we can make a conclusion that the headache is not a simple one. It is due to the increased intracranial pressure. In such a condition, we have to refer the case for further management or an immediate resuscitation. Otherwise, a person may go for death. So such conditions are there. That also come. That is initially I told headache. Who has to treat the headache? Okay, differential diagnosis is very essential, even in psychiatric patients. Okay, we can't see any other sign or symptom. The person will tell, I am having severe headache. I am going to die like that. In such a condition, maybe a psychiatric intervention may be needed. Carbon monoxide poisoning. That is Dhuma's about. Okay, that is Dhuma actually. Vomiting, dizziness, muscle weakness, and blurred vision. I told you about Dhuma, smoke, exposure of smoke, where usually patient pressure of oxygen will be reduced. So oxygen deficiency may result in carbon monoxide poisoning, may lead to the headache. Angle closure glaucoma may lead to headache, particularly around pain around the eye, visual anomalies, usually scotoma, nausea, vomiting, with a dilated pupil. That also we can make out by seeing the person's eye itself. On we can use an NCT or non-contact tonometer for assessing the intraocular pressure, or by a tonometer, shared tonometer, we can assess, or even with the digital palpation, we can make out whether the pressure is increased or decreased. And those who are having secondary glaucoma or in diabetes mellitus and hypertension, etc., headache, hypertension, headache will be a common symptom in those who are having regularly under medication. We have to see the blood pressure always. Okay, even other case also we have to see to rule out whether there is hypertension. Okay, the pathophysiology. Yes, 1 or 2 points. Okay, from where the pain comes. Result of traction or irritation, dilatation, compression of the intracranial or extracranial vessels. Traction, dilatation, compression, torsion, or irritation of the meningeal blood vessels. Usually the headache results from due to the obstruction. We know that there are types of Sodaroda, Adipravritti, Sangova, Siranam, Grantheyobiva. So if there is any excess flow or an obstructed flow or a deviated flow All these results in pathology or in yoga. Adi pravritti sangova sirana grandiyo viva. You might have studied this one. So headache results, traction means, traction, torsion, compression, irritation of the intracranial or extracranial nerve vessels. By doing these things, the nociceptor or the pain sensitive areas are stimulated and the pain results. Other than this, there are certain factors which results in stimulation of the nociceptors. Trauma, usually after RTO, or tumors in the pituitary fossa or anywhere as the brain, a developing benign or a malignant tumor. Stress, undue stress, maybe from official or economical or familial or any other type of stress. Usually in a present situation, stress is very high even in the children itself. Usually children are devoid of stress previously. Now they are also having undue stress, resulting in severe headache, dilated blood vessels, muscles, myalgiitis, myalgia we call it as. All this can result in headache. The brain itself is insensitive, I told already, but is insensitive to pain because it lacks of pain receptors. However, the muscles and bone, etc. of the head and neck are with plenty of nociceptors. Usually, if there is any change, traction or pulling or compression of any of the muscles of nerves in the head, results in severe headache or pain cells, including the extracranial artery, large veins, cranial and spinal, head and neck muscles and the meninges, anywhere. Which can result in pain. Meningitis, that's a common meningitis, or even cervical spondylitis, or vein thrombosis, or any other inflammatory changes in any of the blood vessels, may result in severe headache. So I mean that the commonest condition which I will explain is a condition which is very common in our day-to-day activity. That is our migraine. That's our migraine, and it is it's not so simple. Diagnosis is difficult. Management is also difficult. Even though after management, after giving medicine, it may subside temporarily. Again, it will come back. Recurrence is very common, and even complication is very common in migraine. And the prevalence is high in females, 3:1 in female to male ratio, due to the hormonal difference in their age during menarche or during puberty or adolescence, and even till the menopause or the climactic changes in their age around 50 years. During every period cycle, before and after, or during the period, it can happen. During ovulation, it can happen. During pregnancy, it can happen. So migraine can come at any time in the life of a female. So it is very highly prevalent in female. That's why I told it's very common in our day-to-day practice. Sometimes it may come down by using a simple oil or a simple medicine which is giving some anilomana sabhava or agnidiptigara aushadha, just like an vivattigara chuna, or by using a simple oil that is balagulushyadik thaila for head, or balahadadi dera for head, or kanyunyadi gera, as per according to our Malayalam yoga, it is kanyunyadi medicine, coconut oil, can subside the headache clearly. Only in few cases, okay, not in all the cases. Some cases it won't respond with any medicines. So we have to trace their history, whether they are having the habit of having food, which is a hotel food, which is actually prepared with a monosodium glutamate. Okay, it's a migraine. It's a migraine, right? Trigger gobi Manchurian, like that. Okay. I prepare plenty of masala for getting additional taste. Ajinomoto, we call it. Monosodium glutamate is a content which the adding of these additional taste makers usually results in severe headache, which even you cannot be controlled with even with analgesics or by injections also. The person may go for a severe headache with vomiting and etc. Let's see what is migraine, which is characterized by recurrent episodes of headache, paroxysms of headache, which means a paroxysm. It's regular episodes of headache. Usually unilateral, sometimes it may be bilateral. and associated with visually or visual sensory symptoms or auditory sensory symptoms. We call it as aura. That starts usually before the actual headache. Usually, aura may be without pain, but the person feels something is going to happen. It is something going to happen around, it may from 5 to 15 or 20 minutes it may last. Some person may having nausea, some person may vomit, some person may gastro loose stools, some of them may feeling auditory hallucination, some of them feel some other thing, giddiness, like that. Usually gastrointestinal disturbances are very common. It's most common in women, has a strong genetic component. And usually there are some triggers for migraine. These triggers are usually when I do chocolates, okay, milk and milk products, then heavy food, attending a function in a hall, and maybe attending a marriage function and having a heavy food. So after that, within 1 hour, the person may get migraine. Those who are having migraine tendency, if they are staying a crowded area for an half an hour, due to the hypoxic feeling and the noise disturbance, the person may get an attack of migraine. It will be very severe. Sometimes the patient may need injections, vasograin or ergotamine phosphate, or our medication may be needed. There are some triggers which we have commonly bring back the attack of migraine, including ice cream, milk and milk product, then MSG, monosodium glutamate or Ajinomoto food, then traveling, attending function, and use of some body sprays. Body spray, certain body spray, by smelling itself, the person feel headache. By usage of certain fish, that prawn and etc. Is I'm using fish. Certain red meats, even certain vegetables. That is I got to gobi. Then old food prepared previously 2 days back and kept in the fridge and heated at the time of eating, like that. Means we call it as Vishamashanam Adhyasanam Samashanam. Vidyat Adhyasanam Bhuyo Bhuktasya Upari Bhojanam. Misram Pathima Pathimja Vishamamasham. You might have heard that it is mentioned in Matra Shikya Madhyayam, that various type of food habits, which if they are changed in their character, only even Samashanam. Ashanam is correct. Even Samashanam is not correct. Vishamashanam is not correct. All the things which Trinya Vedani, Khoran, Mrityun, Vyadin, Srijanniva. These type of food types of food items or food types is resulting in even death or death-like diseases. And one among is the migraine. Okay, one among is the migraine. So Ashana, we call it as food changes. Okay, migraine is most common in human and has a strong genetic component. Throbbing or pulsating headache. Severe headache, we can't control it at any time. So the person may feel to even maybe aversion to sound, phonophobia or photophobia, or the person may feel fortification of figures, bombarding, okay, fortification of figures, visual disturbance they may feel, scintillating scotoma they may feel in the aura, and the actual pain is so severe, person may feel irritated and he may get angry, he may have phonophobia or photophobia or any other thing. The pain may sometimes refers to our hand and etc. feeling hyperesthesia or paresthesia they may feel, or numbness they may feel, or in the whole body they feel vomiting or like that. Okay, unilateral and localized pain in the frontotemporal and ocular, but the pain may be felt anywhere around the head or neck. Pain builds up over a period of 1 to 2 hours, progressing posteriorly, becoming diffuse whole of the area. Usually 4 to 48 hours, the headache may go for 4 to 48 hours, maximum 72 hours. Sometimes it may go for a complication, that is status migrainosus or migraine infarction. Migraine infarction usually results in a transient attack of stroke. Usually the person may feel gastrointestinal disturbance like nausea and vomiting. See, in some person, the vomiting relieves pain. After vomiting, they feel comfort. That is due to the bilious attack related to the pitta in our body. So after that, they feel comfort, I will go for a sleep. Then after getting from the sleep, they will be all right. So sometimes the food what they consume, maybe a chicken biryani or a heavy lunch. So after vomiting, the whole content will go outside. The person feel comfort. So that's the reason of how the vomiting relieves pain. How vomiting relieves pain. If the person is resulting that a consumed food is heavy to the person, and he may feel improper digestion. Sensitive to light and sound, photophobia and phonophobia. It is very common. I have seen that in many cases, especially in ladies. They may get angry. They may make quarrel with their family members. May proceed or headaches. Usually develops 5 to 15 minutes or a maximum 20 minutes. And maximum up to 1 hour. At that time, their aura may go up. Aura, when the person feel that something is going to happen, something is going to happen within a short while. Now, he may complain that something is going to happen in a short while. Or it may include a headache, dizziness, then gastritis, then nausea, hyperesthesia or the joints or the limbs, then blacking or blackout of eyes like that. Most commonly visual, but can be sensory, motor, or any combination of these. So usually they may complain that nausea they felt, they got a vomiting. The vomiters after vomiting they feel comfort, or they may go for a sleep. This we call the prodromes of the migraine. Then actual migraine, it goes to the posterdrome. Posterdrome means the third phase where the person feel clammy and exhausted. They may sleep for a long time. Visual symptoms may be positive or negative. The most common visual phenomenon is the scintillating scotoma, an R or a band of absent of vision, shimmering, glittering zigzag, a fortification of figures, and scintillating scotoma, blackout here and there. Okay. Physical findings. While during examination of the patient, we can see that muscle tender. It will be tender of the cervical and neck muscles will be very tender in migraine patient. Then meiosis and ptosis in some person, meiosis. Hormonal syndrome we call it as meiosis. Conjunctival injection. Tachycardia or bradycardia, hypertension or hypertrophy. All these things we can physical findings, and even we can do an examination of if the person is having a repeated migraine, we can go for a hematologic examination, and allergy we can test, hypothyroid, thyroid analysis we can do. So for assessing the person, we can do the normal investigation procedure. Even if you want, once we can do the MRI scanning, that will be quite normal. Usually it will be very normal, but we have to exclude the possibility of intracranial neoplasm or a tumor or benign tumor. Hemisensory or hemiparetic neurological deficit complication. I told you there are two types of complication, that is status migrainosus and migrainous infarction. Usually pupillary reaction will be very, very less during attack of migraine. So in our Shirashula, we explain Vadiga Shirashula. With all these almost some symptoms which is mimicking with our migraine. Increasing in the night temperature, expressive temporal and frontal area, tinnitus, karnashula, karnanada, vertigo, neck rigidity. By applying oils, usually pain will reduce. Mardavam, mardana sneha, sweda bandhaishcha jayade. Pragashakshamada, krana, akasmad vedashamo. Okay, tatravadat, brisham. Okay, so photophobia is explained, and this type of mardavam, ardana sneha, sweda bandhaishcha jayade. Application of oils or even bandaging. Usually, giving a tight bandage to the neck, the person feel little bit comfort. Okay, when we are applying oil and etc., the person will very good comfort after application of oil. Then he may go for sleep. In a Kerala treatment, when Kerala one treatment is there by name Talam, which we use Rasnadi and Shirabala for the head. So it is applying in the center of the head, that is Murda. After application of the head, the person feel comfort, they may fall in a sleep. So type of Adhika headache is having certain similarity of migraine, not all, certain similarity. So actually, it is more related with our Ardhava Vedaka. So when it comes to Paitika Shirashula, where the person feel heat form, small heat formation, temperature, sweating, burning sensation in the eye like that. So it is not having much relation with the migraine. So there are some relation, that's all. So when it comes to Ardhava Vedaka, it actually gives a similar picture of migraine. So when we are managing migraine, we have to think about what Ardhava Vedaka, what our acharyas told related to Ardhava Vedaka. Ardhetu Murdnaha, so Ardhava Vedaka. Pakshat Kupyadi Masadva Swayameva Ubashamyati. Adivriddhasthu Nayanam Shravanam Va Vinashaye. It is a type of headache which comes in the either either any unilateral part of the head. Pakshat, so Ardhetu Murdnaha, so Pakshat Kupyadi. It has got certain recurrence that will use Pakshat Kupyadi. Once in 15 days, it can come back. Pakshat Kupyadi, Adava, maybe once in a month. Adava Dasha. Okay, maybe once in 10 days, according to Sushruta. Adivriddhas, if the pain aggravates very similar, very high, it may result either of loss of any of the sensory organ, such as Adivriddhastu Nayanam, Shravanam Va Vinashe. It may destroy either of the eye or an ear. So it should be treated at the early stage. According to Charaka, Trimarmiya Siddhi tell that Tasmat Prageva Kartavyam Chigilsatu Chigilsevi. Ardhava Vedaka condition, we should treat in the early prodromal stage itself. We should not wait for the actual Rupa. But Sushruta tells that Paksha Dashahat Adava Pyagasmat. Either in Paksha or in Dashahat or in all of a sudden, it may happen. Ardha Vedaka comment. And Sushruta told it is Tridoshaja it is. Bhagavata told it is a Kevala Vadiga. Saraga told it is Kevalaha Sakafova. Anubandha Kafa. Due to Samsargaja it may happen. But Sushruta told it is Tridoshaja. Esya Uttamangam Ardham Adiva Jandoho Sambheda Toda Brahma Shula Jushtam Pakshat Dashahat Adavapyagasmat Kasya Ardhabedam Tridaya Vyavasit. Sushruta tells that the Ardhava Vedaga is a condition. Esya, the pain is very high. Sambheda Toda Brahma Shula Jushtam. It may come with agonizing pain, vertigo, Shula, everything. They're having a premonitory sign just as vertigo, other than the pain. And it occurs once in 15 days or in 10 days, all in and all of a sudden. I told you, the possibility of headache or migraine attack may come after a consumption of a heavy food or attending a function, or where the closed atmosphere, where there is oxygen is very less, where the person is consuming plenty of food, and even including Mishram, Pathyam, Abhatyam. Okay, when there is mixture of Ushna and Shida or Viruddhahara. Okay, Viruddhahara, you heard that, isn't it? Yet Kinjit Dosham Utleshya, Na Nirharadi Kaeda Ahara Jadam et Sarvam Hitaya Upapadhyade. So where mixture, Matra Viruddha either honey and ghee should not be mixed in equal quantity. Matra Viruddha either Samskara Viruddha either. There are 18 types of Viruddhahara. All type of Viruddhahara results in our Asana dosha. Samasana, Vishamasana, Tikshna, I told now. That is according to Matra Siddhi Madhyayan, Misram Patyam Abhatyanja, Bhukta Sivabari Bhojanam, like that. So all these conditions bring back an attack of migraine in the person. So instead of giving medicine, we have to give a small advice to the person to kindly avoid all these things. Otherwise, it may result severely, and even it may result in I don't know. There are complications such as Adivriddhastu Nayanam Shravanam Va Vinashe. Or according to Charaga, Tasmat Prageva Kartavyam Chigilsatu Chigilsage. So Ardhava Veda comes very close to the migraine.
And the common that when we are in our OPD, we are getting plenty of case of Ardha. So in hospital, government college, I'm working in government college. So OPD is many number of OPD I'm every day seeing. I tried what all the medicine mentioned in our classical text, and I have got very good result. I have got very good result only by classical approach of our science. Okay, that is Ashtanga I followed, and Charaka Samhita, certain medication. Then we take sometimes we may get surprising results as 1 or 2 days application, the whole pain will go without any NSAID, any painkillers. The whole pain will come down. The person feel very happy, and they will tell that never I felt happy this much. Some person used to tell that during the aura, no, then a person feels something is moving in front of the eye, flutters they may feel something dirty structure. When they are taking their food, that they feel that some dirty things are there in the food. So in such a person, so treatment I have done with the Charaka Samhita methodology, that is Chadusneha Uttama Matra Shirakaya Virejanam. So Chadusneha means a combination of Krita, Taila, Majja and Vasa. I given 3 patients in the IPD up to 1000 milligram, 1000 gram, not milligram, 1000 gram. That's 1 kg ghee, up to 1 kg have given by increasing dosage from 100 to 700 gram at a single day. And after that, a Vamana Karma I have done. Never the person felt after that that Ardha Vedaka or that complicated migraine. So such a good results we can take from our classical text. Even that person might have taken, person has consulted with various doctors and consumed many medicine. After that, he came to Government Ayurveda College, Kannur. So I treated him as an IPD methodology. So I given certain medicine. I tell what are the medicine what I given in my common clinical practice. Okay. Ardheta Murdana, I think you followed what I told and related to Ardhava Vedaga. It is a Kevalavadika Roga according to Vakpada. It is Dundwaja according to Charaka and Tridoshaja according to Susruta. Even that time itself, there was the concept of Ardhava Vega is very high, and even our Acharya that they were discussing that thing, how to manage this condition. That is Susruta thought Sambheda, Toda, Brahma Shula Joshtam. He told dizziness is particularly he told Brahma. And Atavapi Agasmat, Kasyartha Bedam, Tridaya Vevasit. So based on that, and again Charaka told various area where the Ardha Veda comes, and he told Tasmat, Prageva Kartavyam, Chikilsa Chikilsa, and he told Chadusneha Uttama Matra, Shirakaya Virajanam as a treatment modality. I think you can know what I told. In Kafaja, actually, the person is no Iruji. The person won't believe. We know that it's simply typical. So such cases are usually very less compared to the Ardha Vedaga in the OPD, and the person feel heaviness. Gurutva, Haruji, Kapajesh, Guru, Staimitya, coldness, pulsating, Sira Nispandadalasya. The person feel tired and etc. Such conditions are mentioned in our Kadastasura. Maybe usually compared to the Ardha Vedaka, pain, less pain headache. Okay. So treatment principles, what I want to tell and I want to share with you people, as you are all practitioners, I know that the theoretical part is not essential for you people. So here I will tell the principle, though you have to ask what are the things you need. Okay. So commonly based on the line of treatment, the principle when we are considering Nidana Parivarjana will be the Chikilsa. So I told first what is Nidana. That's I told Doma Atapa Tushara Ambu Krida Adi Supna Jagarehi Ulsweda Adi Purovadu Bashpa Nigraha Dodanehi. So all these are the etiological factors which contribute headache. As much as possible we have to avoid. We can avoid smoke. Okay. Up to a limit we can avoid the exposure to a smoke. Then Atapa, exposure of sunlight, especially in the noon time. We can use an umbrella, no? As our Acharya told, Adapatram Padatranam, Vidivadosha Shodhanam, according to Netra, they have to wear Adapatra and Pradatrana, which is wearing the chappals and an umbrella. Then Atyambu Madhyabana, Kramibihi Vegadharanehi, Ubadana Mraja, Abhyanga Dvesha, Ada Pradadekshanahi. These are things we can, if we want, we can. Ubadhana Mraja, usage of pilla or non-usage of pilla, abhyanga dvesha, application of oil, other pratareshane. Okay. Asatmya gandha, ama dushta, ama bhashya desha shirogada. Exposure of loud noise we can avoid. Keeping that hearing, okay, that always in the ear and always in the connected to our smartphone. We can avoid all this. The contemporary scenario. Okay, the people are always with a case like always they use their auditory that one here phone smartphone ways keeping in over their ear. Okay, then. Asatmya gandha, exposure of foul smelling or toxic smells. Okay, bad smells. Bhashya desha shirogadaha janayanti amayandosha. Atyambu madhyapanena, I mean the consumption and over usage of alcohol. Krimibihi vegadharana, all these things vegadharana. If possible, circumstances are there, we have to be trained with early morning vega udhirana. Recent traveling and etc. It is not possible. Even though we can control up to a good extent and where we can control our headache. I told Sagradaha Pindigo Desha Pradishyaya Shiroruja. Definitely headache will come if that Purisha Vega is not eliminated. So that's where the importance of Nidana Parivardhana. Then Samprapti Vikhatana. Samprapti Vikhatana, when I told no that common exam again we can tell as a migraine. So when we are consuming, when we are attending a function, a party, we can control the food items what we take. We can control. We can control. So if at all plenty of food items are there, we can avoid ice cream at a single time when we are continuing heat on hot food along with as a part of party along with the biryani ice cream is supplying nowadays. That is actually viruddha actually. And again, milk is should not consumed again with the buttermilk like that. Okay, so taste and sugar taste should not be mixed together. But we are taking lassi. We are taking okay. We are taking lassi. So we are only doing all this. Then fruit salad. Then alcohol. Some of them will take alcohol during the party. And if the food is plenty of food, some of them eat like their pot belly is completely filling. So we know that in night time we should not take our food. Should half portion of the stomach should be kept vacant. So in such a condition, if they are taking our food, have to eliminate it. That's why vomiting, inducing vomiting. Okay. According to cause, the treatment goes according to the cause. If the person is having hypertension, Rekta Samarda Vigara it is, we have to use a diuretic medicines to reduce our blood pressure. The pain immediately will come down. If we are having a hypertension, so we may go for medicine like that. Simply Rekta Samarda Vigara it is, isn't it? It is a Sambra, it is a Srodho Rodha Vigara it is. So that Rodha should be eliminated by using the diuretic property medicine or purgating medicine. So we are using Gauchura Churna. The urine will go very fastly, the blood pressure will be coming down. Then Pathya. Pathya means Chikitsidam Vyadhiharam Pathyam Sadhanam Oshadam. Pathya is actually treatment only. Told now that should not use Viruddhahara. Mixing food items. Okay, various mixing food items together is not good for a healthy concept. Following Padache, Pathya is following. Pathya means actually Chikitsa only. The word meaning is Chikitsa Vyadhiharam Pathyam Sadhanam Oshadam. Then, according to our classics, the treatment principles are like this. Okay, here one interesting word is there. That's why I typed Vadika Jerasula Chikitsa, and it comes as a part of our migraine. Application of Grida in the head. We always know about Astirgido Vyamanam, Tada Dailam Gridam Madhu. Apply oils, Taila. Where in Madhika Shirasula, Acharya told Grida Makta Shira. In Siras, we have to apply Grida. Jivaniya Siddha Grida or Madhura Siddha Grida. Any Grida. We have to apply Grida and Mashan Kulathan Mudgan. Means these Masha Kulatha. Masha, we know that it is Kaphavardaka. Kulatha is Amla Pitta Janana. Mudga is okay. Varavatra Mudgo Alpajalaha. These type of actually it comes in Shimpidanya. We call it a Shimpidanya. Mudgadagi Masuradi Shimpidanyam Vibhandagrut. Why the Vibhandagrut drugs say made to eat? As the person is having lack of kapha in their body due to the high Vata combination. Why Vata combination? So it has to be given Brahmanam Shamanatvevam Vayor Pittaniga Secha. That's the reason Why? Masha, Kulata, Mudgadin are Krida Shira. Krida is to be applied in the head, and these food items should be consumed. Milk with Tila Kalka. Milk with Tila Kalka. Consume milk in the night time. Everything is supposed to do use in the night time to reduce our Vadiga Shirashula. Spinda Sweda, Upanaha Sweda, then by using Mamsa and Dhanya, Mamsa Kiri and Dhanya Kiri. So actually, when there is migraine patient, so when we are admitting a migraine patient, this methodology is sought out. They need all these therapies with Deshamula Shiradhara, Snigdhanasya. Actually, common Nasya, what we use means actually Varanadi Shiraguda in Ardha Vedaga or Rasna Deshmula Krida, which is using Varnasya, or Induganda Krida or Vidarya Digrita. What I use in our medicine, our government hospital, what is it is available, Vidarya Digrita and Rasna Deshmula Krida, as well as Induganda Krida, it is available in our hospital. So we use always these type of drugs. So even for application, Rasna Deshmula Krida, I giving a stala with Rasna Churna. And again, Snehapana, we are using Rasna Deshmula Krida or Vidarya Digrita or Panja Shira Shatpala Krida, Pajagone Evashara Shatpalena Pajel, Srodasam Tad Vishodana, that's in Panjagone Evashara, Shatpalena Pajel Krida, Srodasam Tad Vishodana. That's why it is mentioned in our Rajesh Majigilsa. Rasna Simula Krida is mentioned in Kasa Jigilsa, Drone Pamsa de Dress and the Simula Shadavari like that. Panjagasan Shira Kambam Univam Chanavedana. The indication goes like that, which is used for Nasya. Snehapana, everything I am using in our college, we are using Dasmana, then Induganda, we know the Padame, Chaya Mahodara, Gunmashura, Nimno and the Jorahara, Balavardhanam, which is used for Balavardhana, so it is using. Then Maranadi Shira Grudanasya, then Abhinga, we use Danundar Taila or Lakshadi Taila or like that. In head application, regular application, after discharge, used to give Balaguluchadi Taila or Balahatadi Taila for applying their head. Then Dhumapana after Shirovasti is using by using Karpasasya Thaila, Shirovasti is using. Then Tarpana with Sirius and Sravana means both applying Sirius and Sravana, ear and head, that is Shirovasti and Karna Purana by using Krida as well as in Shira, Varnadi Shira Krida, or as well as Thaila, the Danundra Thaila or any other Thaila. So it's a common principle what is mentioned in the textbook. Whichever is needed, we have to adopt. Tasya Mavasaya Chigilsa Tatta Chigilsa Bhisham, H1 is needed. So when there is a chronic Ardhavedaka patient is admitted in the hospital, the following methodology is this one. Are they that one? This one, okay, it is mistaken. Okay, Ardhavedaka is one. Okay, Vadiga Shirashula. It's a part of Vadiga Shirashula itself. It's a chronic migraine case which cannot treat in a simple OP way. He needs an admission, especially those who are having a severe history of migraine from a longer period. Not 1 or 2 years or many years they are having. So such case, instead of using an OP medicine, better to have an IP treatment. In that one, Varnadi Shirapaka. Actually, if you are giving the plain kashaya to the patient, the person may kasha hinsaya kashaya. They may feel again exhausted. So better to use Shirapaka here. Okay, Shirapaka, not only Varnadi Shirapaka, even Patyashadanga we can give as Shirapaka, Drakshadi kashaya we can give as a Panda, or even Gulushadi kashaya, or anything what we are using, that better to make Shirapaka, and for quality result we can use Shirapaka. Ardha Vedaga, Chadu Sneha Uttama Matra Shirakaya Virejana. Chadu Sneha according to Characterized. Chadu Sneha Uttama Matra Shirakaya Virejana. Chadu Sneha means, I told it is a combination of 4 types of Sneha. That is Krida, Taila, Pasamacha. Shiro Virejana means Nasya by using Varnadi Shira Krida or other or even in some condition we need some other medicine, that is Yadasumi Yogige Snehi, Madhupatvasavevi. Even with some chronic type of headache which is associated with sinusitis, then Adhishta, etc. we have to use for Nasya. Then Kayajana means Murdhadaila is Vasti, then Vasti Kriya. Vasti Kriya means Yoga Vasti or Kala Vasti or Karma Vasti. Okay. These are the main methodology what we follow in Ardhavedaka Chikitsa. Okay. In Paitika, we usually Lugavadana or Rekta Moksha, where Rekta Dhatu has to be corrected. Shida Lebana by using Kushta Kudilu Pelechandanehi and Shadibadikana and Lebana Mukha Leba, Shiro Achidahanam Lebanam Mukha, Leba by using our common drug is Mukadi or Shadibadikana. Then Shiradhara by using Guluchadi Shiragata or Chandanadi Shiradhara. Then Shodhana Vasti using Yoga Vasti. Then Lebana usually by using Paithiki Shirajula, but the very common drug is Kushta Kudila Ulpanajandri, Kushta, Tagra, and Utpala and Chandana. Kushta Kudila Ulpanajandri, Pitta Digaruja, common Lebana Yoga is Kushta Kudila Ulpanajandri, which is using in our OPD. Then Khabaja, it is with the Jirna Krida and Vamana. One or two, usually do once Vamana. It will be always better by using Yuksha Tikshnosha Aushadas. Then certain medication, time is over. Certain medication, what I am telling is Siraveda in Siraveda I'm not doing, but I used to do Januga Vajarana. Then Suryavarte Vidhadavya, Nasya Karma Di Bheshajam, Jangalam. Okay, sweet articles. Okay. Madhumastaga Samyava Krita Puresha Sevidehi. Okay. Then common drugs. One or two drugs. Okay. What do you use common drug? Kashaya, Patya Shadaga Kashaya, Drakshadi Kashaya, Varanadi, Amurdotra, etc. Shardana Juna, Ashtajuna, Vaishana Juna, etc. for Agniditana, Agnitigarayas. Okay. Then Nasya, Eladigera with Saindava, Shuntiadigera, Avartana Jacha, Danudara Avarti or Shiravala Avarti. Then Swarasa Nasya is Tolasi Swarasa and Lekhan and then Tikshanasya by using Pepeliasva, Vedangajuna and Saindava, etc. Even other than that, Shadbintu Taila, you are using. Okay, when according to the need, prepare the Nasya Dravya and use. Okay. One more thing we are using actually. That is Suryavarta, which is using in Shundi Churna. That is Shundi Churna with milk. Okay, Shundi Churna with milk. Then Ichurasa and Ardragasvarasa. Okay. Then Kanyunyadi and Taila. Okay. In some cases, not in all cases. Okay. So some medicine I told. So if anything, any doubts related to that, you can ask. Okay, time is going, but no, it's no problem. You ask questions. Okay, I need a good discussion related how I treated. So according to your question, I will answer. What are the drugs were I selected? Okay, so thank you for your patience, and I am thanking the authority of this team CAME for inviting me a session related to concept and practice of headache. So once and again, I'm thanking all of you by listening my classic my version. If there is any error, please apologize. Okay, so there is some problem with the net, I think. So if any doubts, you can ask now. Thank you once and again.
Thank you so much, sir. That was a very concise and interesting session. And just a reminder to all the participants to ask the questions directly. Please use the hand raising option and wait for the host to unmute you, and then you may ask your question. And those who want to ask the question in the chat box may type it there. Thank you. Sir, Dr. Renu has raised her hand, so I'll ask her to unmute now.
What is the question in the chat box? It came.
Good evening, sir. Shall I ask my doubt, sir?
Definitely.
Sir, recently I had a patient.
Okay.
So she was having a headache. So I had diagnosed it as a Pitta Shirashula because all the causative factors which was aggravating the pain was like Pitta Vardhaga Ahara Viharas. And even she was having a tenderness in the parietal region.
Okay.
All her
so
reports like MRI scan.
Meningeal vessels. There is constriction of meningeal vessels. That's the reason. Okay.
Yes, sir. So even the MRI like reports were normal.
It will be normal always.
As when I was examining, there was frontal as well as maxillary sinusitis. So first I thought of going a Kabahara line of treatment, and I started with the Untitled Nasya. She was completely comfortable. She was 3 years. She had a continuous headache that was completely subsided with this
Very
Nasya.
good.
So after the 7 days of completion of Nasya, I planned for Shirodhara with the Madhu Yashtiyadi Kerap, as I had thinking that there is some pitta aggravating factors. But the third day of Shirodhara, again she started complaining of headache. What may be the reason? I was just
Thaila is
thinking.
not good. Thaila is not good.
Okay, okay.
Thaila is maybe instead of you should put out used Luchadi Shiradhara or Drakshadi Shiradhara. Kashaya always Shiradhara will be good instead of oils. Oils are the guru in nature. No? Thailam Soyoni Vaktatra Mukyam Tishna Navaja. You know that, okay. Tukdosha Krita that Shutsham. Tukdosha Krit. It is a Chakshutsham. Okay. So when we are planning always Dhara, better to take Shirapada or Takra. Better to be always or Kashaya will be more better. And again, in Paitiga Shirashula, initially it should be started with Lebana. That is Shiro Lepana, we call it as Shiro Achi Dahanam Lepa. By using Dhatri Churna or Sharibadi Gana or Kushta Kudila Ulpana Chandani. Okay. Any of these can use for Shiro Lepana, followed by the Shirodhara by using Shira Prayoga. Pitta Haratva is maximum in always Shira always. Where Thaila aggravates Pitta. Okay.
Okay, sir.
Thaila always aggravates. That's the reason. Actually, initially what we started with Anutaila Nasya. Even though Anutaila is a Samana Nasya, when we are doing Nasya, Shirasaha Sleshma Dhamatva, Samanya Nasya Vairajaniga Vikichare. Shirasaha Sleshma Dhamatva, Samanya Nasyam Vairajaniga. Whichever may be the Samana Nasya or Brahmana Nasya or even Virajana Nasya, when we are applying in a person, due to the Sleshma Dhamatva Subhava of Shiras, it effectively acts as a Vairajaniga Nasya. So even if you're using plain Kritaila or Anutaila or whatever it may be, it results in kapha nisaragata. Anubandha kapha will be eliminated by using nasya. So next time, when we take oil always aggravates the pain. That is a constriction of the blood vessels. No? So when we are applying lepana over it, the constriction will be removed. I think you understand.
Okay, sir. Thank you.
It's always simple trick for this one. Shiradhara takes it only one drug, Sariba, plain Sariba or Santana is sufficient. Okay, only one drug is, even though that is also sufficient. It will reduce the pain very fast. Okay, thank you.
Okay, sir. Okay, sir. Thank you so much.
Thank you so much, sir.
Okay.
Thank you, Dr. Renu, for that question. Now we'll move on to the next question.
Okay.
Sir, approach in conditions where both sinusitis and migraine is present.
First one, we have to control migraine before starting sinusitis. What will happen now? If migraine they can't suffer first of all. So for planning a person, those who are having together at a time, the decoction what we take will be helpful for them. Patyashadanga Kashaya is good for Ardhava Bedaga as well as sinusitis. Okay, you can take the two Ardha Patyashadanga Kashaya as an option of choice. Then irregular annulomana will give result in sinusitis as well as in migraine. For Vada, annulomana is the best treatment by using Vaishwanare Churna, Patyashadanga Kashaya, and the hair oil, the Laguluchia Taila application or the Lahadadi Taila application in the head. A Tala with a Rasna the Chuna, any of the Taila will give good results. After 1 week medicine, Shamana Ushada, go for a Virajana Nasya by using, I think in maxillary sinusitis, there means oil, Thailanasya won't work. Always Kalkanasya or Churnanasya will work. Okay, Kalkanasya will be more good or Sverasana. That is Sverasa, Indupa, Haindava, and Vitality Churna. I use in our hospital, we use all these things. Okay. In our hospital, we use Pipalyasava, Vidanga Churna, Madhu, and Chaindava as Krishna Virajana drug. So,
okay, sir.
That
Thank
will be
you.
more. Okay, okay.
Okay, sir. Can you share your experiences on treating insomnia?
Oh, yes. One or two cases I will tell. Okay, person.
Okay.
I actually told a person now she came in OPD. I think 4 years back. Okay, with severe migraine and taking medicine for last 15 years and taking every day that vasopressin tablet. I came to the OPD and I have seen that he's having actually ophthalmoplegic migraine as she got even secondary glaucoma also. The first main problem is that when she takes her food, she sees something inside, some dirty things she will see. That's very, very, very horrible condition it is. Means that is due to the, I don't know, gastrointestinal disturbance and visual disturbance. Okay, that's premonitory aura. Usually, when it comes in once in a while, etc., that 2 days will be very horrible day for her life. So, like that, she came to our hospital for an admitted treatment. So, my various type of migraine I have seen. This migraine so that I have seen that pain. Even giving tramadol injection, the pain was like twice that lady to the medical college nearby our hospital for injection. Even though that is not reduced, that we suspected it is retrobulbar neuritis, but it was not. MRI suggested that it is now there is no retrobulbar neuritis. It is clearly of migraine only, ophthalmoplegic migraine. It was then started with first I given a Rukshana Krama by using Udvartana and Valuga Sweda in government hospital, and after 5 days Rukshana Krama by using Takra and Panchagola Churna twice, 2 days. Then after 5th day, started after Agnidipti, started treatment with Snehapana. First day treated with Ghrida, that is my Rasnadashmula Ghrida, 50 grams. So after 3rd day, that is 150 day, I added Irregular, Chaila, 10 ml to each. After 5th day, I added Vasa. So we have in our IP for Tarpana, we keep our Varaha Vasa always with us. And Varaha Vasa, that is actually Yamaga. Trivirdo Mahan. It is for Trivirda. It's not Mahan, it's Trivirda. It will become Trivirda. Like that, I give given for 1 day single dose as 500 grams of ghee and 100 ml of Shirabala and 25 ml of Vasa. That day she vomited and we stopped. After getting Samyak Lakshana, subjected for Abhinga Ushma Sweda, Sinta Devotion, then Girasabuktra Hamajare. Then after that, Vamana is started. I was given a Vamana by consuming Masha and previous day Masha and Mansya. The next day with milk, 3.5 liters of milk and 3.5 liters of Eshti Kashaya, given with Halabipri Churna, Vacha, Pipli, Saintava, and honey, milked with water, and done a very good stage of Vamana. And it was at a Samyak Lakshana in Vamana, then followed by an Virejana. Then next treatment was Nasya. By Nasya doing none with this Asma-Vishmula Grida, I told I got very good result in the Asma-Vishmula Grida. Meantime, she never got any headache. And after that, after Sirovasti, then when Shodhana Vasti I have done, that is Yoga Vasti. After they were using Madhudeli as a Yoga Vasti as a Brahmana therapy, then when last one, Shashtika Lebana. Then I discharged the patient and came back every 15 days. Even after completion of 3 years, never she got the headache afterwards. So now also she bring some of them patients to the hospital and tell that after the Vamana, I never felt headache again. Till that Vamana, I have been feeling some pain in my head. So I understood that when we are following our classical text as such, the treatment will be 100%. So nobody can conquer it. That much confidence I attained after that treatment. So then usually OPD treatment, I give some oil to the head. Okay, Balaguluchari Taila, then Drashadi or Guluchari Chirabaga or Patyashadangam Chirabaga, like that simple medicine for OPD management. But if it is a chronic headache, a thorough admitted treatment with a good quality Nasya and one Vamana. Vamana is essential for that. Snehapana and Vamana is essential. Then never it come back. The Panchakarma therapy, among that Vamana is very, very good. I have seen. I have getting excited while telling that. Okay, sorry, no. Okay. So that much result I got. So thank you for asking to me. Okay.
Yes.
And still remember. Okay, they are frequently also they are coming for some other condition. Okay. Thank you.
Thank you so much, sir. So one last question. Can you please share about insomnia cases where insomnia can cause headache in many people?
Definitely, definitely. As you told, the headache may sometimes go to psychiatrist initially. The introduction I told. Insomnia, Nidranasham Janayadi Rasala. Gaushada we have studied. So what I felt means Hidamatyak Nanidredio Gadio Mahisham. In Nanidra, Mahisha Shira should be used. So one case I have done with some psychic intervention is there the patient. In that Mahisha Shira and Mahisha Gruda I applied and Mahisha Shira Dhara I have done. That is available in the area. Mahisha Shira is available and that Gruda also is available. That is used for Snehapana and Nasya. And that person I have given regular, even now also he doing that 011. We call it as Talabodichan or 011 by using Jatri Churna and Saribadikana. Regularly he is applying and taking bath and oil, that is the Belaguluchi Kaila is taking. Admitted treatment is not needed in all the cases. We can give Chandanadi or Tungadramadi or Himasagra Kaila for applying and one Saribadikana yoga. Then internal use Shvedashangushpi Churna, Goksha Jurna, Ashugandha Jurna, and Sarpaganda Jurna as one pinch. Altogether, 4 pinch, that is 1000 milligrams or 1 gram per day in divided dose. Then Kalyanaka Gruda or Mahakalyanaka Gruda, any of them, or Brahmi Kalyanaka Gruda, anything. That would be sufficient for the sleep habits. And our classical test now, Charaka Samhita Panchasana Kashaya is mentioned, okay. That is Sapna Nashika, Sapna Bodhaka Dravya, any of the drug we can give as a Sapna Bodhaka Dravya as coming back to the mental correction. Okay, thank you, ma'am.
Thank you so much, sir.
Thank you.
So we have come to the end of today's discussion. And I thank you all the participants for your patient listening. And if there are any more questions, I hope it's okay that we'll convey to you later.
Hello.
So,
Hello, sir. I like to ask, sir. In a Sanhitas, which all adhyas like specifically we need to read in thorough for this Shirorog like 3 Marmiya in Charakana and other Sanhitas also, which you can guide in for that.
Once more, madam, I couldn't get it properly.
So in the Sanhitas,
Hello. I think it is good. Hello.
For this Shirorogas,
Can you type it in chat box? The audibility is not.
Fine. Okay, fine, sir.
Hello. Hello.
Yes.
Hello. Sir, I just wanted to know that which all, apart from our Charak Shushrut, which other Sanhitas also we should read in for knowing this Shirorog in detail. Which are the books also?
Okay, sir. So Dr. Kima is asking about the Samhitas.
Okay.
Charaga and Susrita are what we commonly follow. What other textbooks should we refer to deal with Shirorogas in detail?
Susrita Samhita, madam. Susrita Samhita. Other than classics, and one Malayalam book is there by name Chikitsa Mandiri. It's good for Shiroroga.
Okay.
Malayalam book. Okay. And translations are available in English. Okay.
Okay. Chikitsa Manjari, sir.
Okay. I think it is available in English. In Kannada it is there, in Tamil it is there. I think it may be there in English.
English will be okay.
English will be there. You are from which area, madam?
I'm from Maharashtra.
Maharashtra.
Hindi
they have republished it in recent Hindi or English translations there, I think.
Okay.
Quotation is in the slokas are some slokas in Malayalam, remaining slokas are in semi-Malayalam, not in fully Sanskrit and not in fully Malayalam.
Okay.
Many medical, some medicines of that is Hundi, Shira Nasya is mentioned in that text only. I used to do in my IPD. Sundi, Chuna and Shira, I use Nasya in migraine. And like some short available medicines are there.
And from Charak Samhita Trimarmi Adhyay, we need to be thorough
Yeah,
about it.
Trimarmi Adhyay, Trimarmi Siddhi. It is Trimarmi Siddhi. Then Shiroyoga Pratisheda in Vagbada. Okay. Then Madhava Nidana, only if Nidana is there, Chikitsa is not there. Many treatment, Yogaratnagara, some treatment is good. Chakradatta, some treatment is good. Okay. Mahavashati Kashai Secretary is there. Chakravani Datta it is. Chakravani it is. Chakradatta.
Okay. And this Chikitsa Mandiri also.
Yeah,
Chikitsa
Chikitsa
Mandiri.
Mandiri is there available. Translation is available. Even Sahasra Yoga nowadays is available in some Hindi and English. It is available. Srikandamuthi is translated, I think.
Okay. Yeah. And so, which all medicines, like you have suggested many medicines, like many oils and many this grutas and all. So, like
there are some Sahasra varieties, which are from Sahasra Yoga.
Yeah, but
And
what like we can't keep all, but what which must like they should be only like they are take the need of the art.
Then Pharmacopoeia of India it is available. Again, Kotak Radishala, their book is there, no? Yoga Grantha. It is available in
No, sir. I want to ask which all like medicines like we need to have like for surely for in a clinic for like among the grutas and telas like for Shiro Roga like specifically.
Okay.
Yeah, because you have there are many things you have told in. So among that like we can't keep like all like but what in the like we have will be always useful like which will suggest this like for Mahasneha like you have used many a times.
So or applying or intending.
Similarly, which other drugs like among the telas and
so usually okay. So applying I use usually in our area, usually Balagulishari Taila, Lakshari Taila, and Balahata Taila. Internal use we use Yasna Dashimula Krita and common available here. Okay, Jivania Krita, Shira Shatpalakra. I don't know whether it is available in your area. It is available in our area.
Okay. Yeah, it's available. Sir.
Available. Okay. Shatpalakrita is very good in headache. Okay, management of headache. Shatpalakrita is very good.
Okay, so it is in like Vat Pradhan or Kaf Pradhan, like
no, both it is good. That's why I told. When we are selecting a drug, if usually Naigadosha Sadaroga, Sasma Nagarasandravya, okay, there won't be a Roga is simple. Actually, only Ardha Vedaka won't be there. Usually the person may have associated sinusitis. So in addition, Shatpalakrita will be helpful for both instead of using a single drug. Okay, it is got multi-directional usage.
Okay, sir.
Shatpalakrita will be good.
It is good Deepan Pachan also.
Yeah. Panchagoda. Okay. Yavakshara. Shatpalakrita. Both are very less, but the action is very high. Srodha
Yes, sir.
Srodha.
Jivanti, like we get also and we can prepare also.
Yeah. Very simple, no, madam. Very simple.
Yeah.
Panchagoda and Yavakshara over. No, that's all. Okay. Usage is very high.
Okay. But sir,
Asana is a very big yoga. This is very simple yoga. But even it is very good.
Okay, sir. And so for Shirodhara, usually like Quat or Taylor causes Pitta Prakop. So other like
Shirodhara is good, madam. I mean, my experience.
Shirodhara, okay.
Whatever the condition, Vada, Pitta, Kapha, or whatever it may be, when we are applying Shirodhara, pain immediately will come down. That is mentioned in Vadarati Vigasa. The Shimula Shirodhara is mentioned in Vadarati Vigasa.
Yeah.
But wherever we use it, we get result. So next one, madam, really asked, the use the pain aggravator. When we are using pain aggravates.
Yes, sir. And many times the patient is not.
Better to always there. Shirodhara is good.
Okay, sir. Very nice.
And
thank you, sir.
Shirodhara is good. Okay. Preparation is also that much expensive. Not that only 2-3 packets, 1.5 liter milk is sufficient. Okay.
Yeah.
That oil we need more than 500-600 rupees for 1 day. And it's Shirodhara is feasible.
The patient is not ready to taking continuation also, sir. It becomes heavy only. Like,
Yeah. We are using cost-effective. We are not using cost-effective medicine. They can't follow, no, madam.
Yeah. Yes, sir. So it was a very nice lecture, sir. Very excellent, sir. Thank you so very much.
Welcome, madam. Welcome. Thank you. Acute attack management migraine can be acute. How can we manage acute migraine? Acute migraine attack, no. So we have to apply Shiro Achi Dahanam Lepana. It is Lepana we need. I told you Kushta Kudila Utpala Chandane. Kotta, Kushta, Tagara, Utpala. That is actually and 0.5 with hydrophyte. Okay, Utpala. I don't know whether you know that plant. Okay, I have the plant that tuber of that drug, root tuber is very effective in reducing pain. Then Chandana, by applying a paste, okay, over the scalp, the pain immediately will come down, the patient will sleep. Then internally we have to give Trivirchurna with sugar and honey. Sarkarela Trivirchurnam Madhuyukte Virajini. Sharkara Ela Trivirchurnam Madhuyukte Virajini. Very simple medicine. Pain immediately will come, no need of any painkiller. Management of vertigo. Vertigo, you have to identify the cause first. Whether it is due to cervical spondylitis or cervical radiculopathy, or whether it is due to the ear problem or internal ear problem. And we have to identify to differentiate the diagnosis. And if it is cranial cervical problem, we have to give the treatment for cervical radiculopathy. And if it is ear problem, we have to give ear problem. Both treatment is different. One is Rasadhadushaya triggers, one is Asidhadushaya. Okay. Rasadhadushaya comes in ear problem. So Rasadhadushaya we have to Rasobi /Mava. That is different treatment. Where in Astidhadushaya we have to use Astimardeya we have to use Brahmana therapy. Okay, both are different. Okay, one is Agnidiptigara and Anilomana, one is Amapajana and Anilomana. Treatment is different. According, we have to identify the cause. Okay, then only we can tell the treatment. The Kulushadi and the Rashadi will be the two drugs which can be adopted in this condition. Okay, I think you can follow. Grishma Mohan is asking, I think. Okay, ma'am. Whether I don't know whether he followed it. Actually, we have to differentiate that vertigo first. Otherwise, the treatment won't be effective. Rashadi Kashaya is very good for vertigo, but even though in that we have to differentiate whether it is due to Astidhadushaya. Okay, cervical spondylitis, or whether it is cervical with or due to vertebral artery insufficiency or due to any other kind of, whether in hypothyroidism it may happen. So we have to correct the hypothyroidism. Whether in anemia it may happen. Okay, then we have to correct the anemia. Then Costa problem. Then there is Agni Mandya and etc. Indigestion problem. The Brahma can happen. Even in our migraine, Brahma can happen. So we have to identify the cause and we have to take it. Okay. Thank you.
Thank you so much, sir.
Thank you, sir.
So with this, we'll wind up today's session.
Okay,
thank you, sir. So it was very interesting to listen to this class. You have patiently explained each question and in great detail without compromising what we needed to hear.
Ask a question. That's why I have to ask questions. Being a practice, I can share my feelings. I can share my experience.
So one last question, sir. This Keshar, this Kumkum Dugdha also they use now for this for acute pain.
Which madam?
Kumkum Siddha, like a group.
That only some problem with that, I think.
Kumkum Siddha Dugdha.
Kumkum Siddha. But whether Kumkum is there in the text, Karkara Kumkum Siddha. The thing is, the Kumkum is always adulterated, I think. I don't think it is original in quality. Okay. If it is not original, it may affect very badly, I think. And adulterant is very high in Kumkuma, isn't it? Saffron
okay. Okay, sir.
It is not original. We are using for Nasyan. Internally, we are applying. If it is a native quality substance, it may irritate to the brain. Nasa is Sirasodwar. It is the opening of our brains. So if we are applying it, drug is not good. I have not tried Kumkuma. Okay. Kumkuma, okay, take that thing. Okay.
Okay. Thank you, sir. Okay.
Welcome. Thank you.
So, thank you, sir.
Okay, ma'am.
Thank you, Dr. Kimaya. So, we'll be back again for another wonderful session tomorrow. And thank you so much, sir. We hope that you'll continue to support us again. And all these participants will always remember your wise words today. And thank you so much. So, we'll see you again. Have a very good night.
Oh, thank you, madam. Okay, we'll start. Bye.